good morning and welcome to the AM News with me, Mapito CBD. Now, first story, President Akufo-Addo says Ghana is backing all African countries from which the US, UK and EU have banned flights to oppose the measure. The bans came into force due to the detection of the Omicron variant of COVID-19. President Akufo-Addo says the new strain started from Europe and will not be fair to lock out African countries.
We repeated our firm opposition to all attempts to single out African countries for the imposition of travel bans as instruments of immigration control. When we are told, for example, that the Omicron variant of COVID-19, which was recently sequenced and reported because of their knowledge and expertise by South African scientists, was discovered much earlier in the Netherlands. Those scientists should be applauded by the world and not be the object of condemnation in travel bans.
Let's go to Kumasi now. Government is planning to change the ratio of students studying science and technology to those studying humanities. Now, that's according to Deputy Minister of Education, Reverend Tim Fojo. He indicated the country is only 12% of the student populace pursuing science, technology, engineering and mathematics education. He believes the new strategy would help facilitate national development. Emmanuel Bright-Kweku has more in this report.
Speaking at the 4th Ghana Science Olympiad, the Deputy Minister indicated the government is putting in place tenable measures to have a 60-40 science to humanities student ratio. He says the curricula at the basic level was reformed to standard-based to initiate processes towards the attainment of a human resource with requisite skills for national development.
So we are not only concerned about creating access and expanding access, but we are also concerned about reimagining education, and that is where Dr. Yao Edichum is leading the charge to ensure that education is reimagined and we realign our strategies to strategies that will be able to produce in our population the kind of skills that we need today.
The Ghana Science Olympiad was organized for students from Secondary Education Improvement Project, SEP, and non-SEP schools. The national contest tested students from various senior high schools on a scope of scientific skills and knowledge in integrated science and core mathematics. The participating students were taken through practical scientific sessions to better grasp underlying theoretical scientific concepts. Director of the Science Education Unit, Ghana Education Service, Mrs. Olivia Opare, indicated the unit observed the country's secondary educational system lacked adequate practical sessions, hence the need for students to be exposed to practical aspects of sciences and mathematics.
And in Ghana Science Olympiad, our main focus is to engage these little ones in practical science, including mathematics. We expose them to practicals because we have realized that they lack the practical aspect of the sciences. So bringing them together here, we give them all the needed exposure.
Emmanuel Finn of Imprayeso SHS emerged as the overall best student at the just-ended 4th Ghana Science Olympiad. He received a gold medal, laptop, plaque, certificates, some textbooks, amongst other souvenirs. Some students share their experiences and how beneficial the program has been to them.
For school, the questions are mostly instructions. We are told what to do, but for this one, we plan investigations on our own. Therefore, we apply our knowledge on certain topics that we've learned already.
From Kumasi, Emmanuel Bright-Kweku reporting.
Japanese technology company Sysmex has handed over a urinalysis analyzer to the Konfanachi Teaching Hospital, Keth. The analyzer can be used in the diagnosis of non-communicable diseases, including diabetes, kidney, and infectious diseases. Use of the machine is less time-consuming and improves testing capacity and quality to stabilize the current urinalysis workflow. The equipment was donated through a collaborative program for the dissemination of Japanese technology for automated urinalysis diagnosis in Ghana.
In 2018, Sysmex Corporation launched a public-private partnership project with Japan International Cooperation Agency, JICA, at the Konfanochi Teaching Hospital under the Ministry of Health. The partnership is themed Collaboration Program with Private Sector for Disseminating Japanese Technology for Automated Urinalysis Diagnosis. Chief Executive Officer of Komfanochi Teaching Hospital, Dr. Ohineba Owusu-Danso, explained the JICA project will provide operational efficiency and also assist in research work.
It has actually provided us with the latest urinalysis testing technology, diagnosis of the NCDs such as kidney diseases, diabetes, and diagnosis of infectious diseases. This technology provides operational efficiency.
Managing Director of SESMIC West and Central Africa, Eric Osei, said the equipment is less time wasting, has expanded access, and ensures public safety.
The project is about dissemination of new Japanese technology for testing of urine. We need urine testing to diagnose infectious diseases and non-communicable diseases. The main objective of this project is to transform Komfanochi from manual urine testing to automated urine testing. With automation, you have 3 steps: taking of the samples, analysis, and then sending results to clinicians. And this helps in reducing the turnaround time for patients in the hospital to get their test results and prescriptions.
Ozawa Maki, the senior representative of JICA Ghana, explained the deed by the company who promotes the government's health agenda. She asserted the equipment will reduce deaths caused by non-communicable diseases.
The technology has been also noted to provide new diagnostic parameters that have helped in predicting kidney disease, which also leads to early detection of the treatment of the NCDs. With this, Ghana stands for a strong chance to reduce 43% of this caused by the NCDs, as estimated by the WHO.
From Kumasi, Emmanuel Bright-Kweku reporting.
In the Borno East region, 4 persons are currently in the grips of the police command for allegedly manufacturing, assembling and repairing all sorts of weapons in Zabrama, a community along the Kintampo Prong Road. The move, according to the regional command, is part of measures taken to clamp down on the illegal manufacturing of ammunition in the region. Correspondent Anas Sabit has more in this report.
The Borno East Regional Police Command, through intelligence-led operations at Zabrama, a community on the Kintampo Prime Road, arrested 4 persons suspected to be manufacturing, assembling and repairing all sorts of weapons at their respective blacksmith shops without license. ASP Amponsa Bosse Dankwa is the regional police PRO.
The Borno East Regional Police Command have successfully embarked on a similar exercise at Zamrama near Kintampo, and 4 suspects, namely Daniel Akuyamwa Boatin, 55 years, Timothy Jakon, 39 years, and Paul Yeboah, 45. The last is Dokrugu Zakaria, 31 years. These suspects were arrested for manufacturing, repairing of several weapons, of which they do not have any permits.
At least 8 gun butts, 4 gun barrels, 4 gun bridge blocks, 14 BB spent cartridges and other gun implements were retrieved during the arrests.
When we chanced upon them, 8 gun butts, 4 gun barrels, 4 gun bridge blocks, 14 spent BB cartridges, 6 live BB cartridges, 2 garden gun cartridges, other gun implements, and other parts were retrieved from suspects Daniel Akuyamwa Boatin, Paul Yeboah, and Dokugu Zacharias shop. Again, 4 gun bars, 2 bus barrel, 2 AA live cartridges, 4 spent BB cartridges, and 2 pieces of military camouflage, that is hat and military bag, were also retrieved from Timothy Jakon's shop.
The police say the move forms part of efforts by the command to clamp down on the activities of illegal manufacturing of guns across the region.
As we indicated to you the last we met, that the exercise to clamp down on the activities of this illegal manufacturing of weapons is ongoing, and the command will not relent on our efforts to halt all their activities.
The suspects are currently assisting with investigations and will soon be arraigned before the courts. Reporting for Joy News, Anas Sabit, Tichima.
And in the northern region, the Dean of Students for the Faculty of Education at the University for Development Studies, Dr. Ibrahim Mohammed Gunu, is worried about the effect of COVID-19 on education in the country. According to him, physically challenged persons are the most affected, especially at the tertiary level, who have had to resort to e-learning. Dr. Gunu raised these concerns at a ceremony to mark the International Day for Persons with Disabilities.
Set aside to celebrate persons with disability and to raise awareness on the need to promote an understanding of disability issues and mobilize support for the dignity, rights and well-being of persons with disability. As part of activities to mark this year's event, the UDS Faculty of Education, under the Center for Educational Innovation and Leadership, in collaboration with GRADA, NORSAC and Oxfam, held a dialogue session with stakeholders to highlight challenges facing persons with disability. Speaking at the event, the Dean of Faculty of Education of the UDS, Dr. Ibrahim Gunu, said most students with disability are yet to recover from the loss they suffered when the country resorted to e-learning during the outbreak of COVID-19.
The COVID-19 pandemic has threatened to affect academic progress, particularly for the most marginalized groups, including people with disabilities. It must be mentioned that in search of normalcy during the COVID-19 pandemic regarding teaching and learning in Ghanaian schools, educational institutions were compelled to adopt online teaching and learning. The decision to conduct online teaching and learning excluded some students from academic work, most especially persons with disabilities, thereby denying them access to quality education as enshrined in the SDGs.
A former regional president for the National Association of the Deaf, Sani Ibrahim, raised concerns over the lack of a senior high school for the deaf in the entire region to accommodate graduates who leave junior high school.
The disability always travel to the down south, so that if they can also get maybe an educational institution that will support the disability people in the northern here, it's better than always traveling to the south. So why can't they open a school in the north here for the disability people to save them the time and money traveling down south?
A member of the association, Abudu Al-Hassan Defaya, questioned why most persons with disabilities still cannot access the disability fund after several years of its existence.
So many persons with disability have access to the fund. Though we are happy about the kind of the fund, we are happy about the government coming with the support, realizing the dreams of persons with disabilities, and as well as realizing the fact that they need to be supported. I think we still need more. I think that it's not enough.
And that's it for the AM News. For more news, you can log on to myjoyonline.com. My name is Mapita CBD. The AM show continues with any more. Don't go anywhere.